Thank you very much, Jennifer. Good morning, good afternoon, good evening to all the young people and all the people who are watching us and who are connected here today. We're so glad you're here. We're so glad that you joined. My name is Jayatma Vikramanayaka. I am the UN Secretary General's Envoy on Youth. A very warm welcome to all those who are joining us for the first time and those who have been with us on the previous 4 webinars. Welcome back. Today's session is the fifth in the series, and we have loved engaging with all of you throughout. Your responses and feedback from around the world on the previous webinars have helped us shape today's webinar as per your suggestion, requests, and needs. How we feel inside is very important. And as the pandemic continues to change and expand in different and unexpected ways, we need to make sure that we take care of our mental health as much as our physical health. So in today's session, we will explore the question, when is self-care not enough? In the last session, we discussed the importance of self-care, how to practice self-care, how to develop our self-care plan. But there comes a time when self-care is not enough. So today we will discuss what that next step is. So with us today are a wonderful group of young people and mental health professionals. And today's session will be in 3 segments. First, we will hear about the journey of 4 young people, 4 young advocates, practitioners from 4 countries who will participate also in a stress bucket exercise at the end of that session. We will talk about stigma against ill health and get a preview of an upcoming documentary on mental health by a young filmmaker in the second segment. And finally, we will discuss with child and adolescent psychiatrist Dr. Gunjan from Nepal and Dr. Fahmi from WHO about seeking support, linking to resources, and how young people can access these resources in the last segment. So let's move to our first segment. Journeys of young people can be very powerful. It can be a powerful source of inspiration and hope, stories of resilience. Hearing how they overcome difficulties can give us hope and encourage that we too can cross difficult times and cope with difficult times and stay strong and stay resilient. So we have with us today 4 young people from 4 countries, in fact 4 different continents, to tell us their stories and share their coping tips. First, we have Grace, a mental health and NCD's lived experience advocate from Kigali, Rwanda. Welcome, Grace, to our 5th webinar. To start off, can you tell our audience, Grace, a little bit about how you became a mental health advocate?
Yes, thank you so much for having me. My name is Grace Katera. I'm from Kigali, Rwanda, and I guess that's where my need to become a mental health advocate came from. My country, as everyone knows, suffered through one of the worst things that could ever happen to mankind, and my family was not exempt from that. So my family and I are genocide survivors. And so growing up with that lived experience and the fact that we were refugees in a foreign country and being diagnosed with mental health illness, problems, but not receiving the appropriate care definitely led me into a journey, a spiral of badness. That's what I usually call it. And so as I grew up, I saw how much it affected me, but I also saw how much it affected my family and the people that I call mine. And when I became an adult, I decided to take matters into my hands and become part of the solution. So as a lived experience mental health advocate, it means that you have gone through the same things that everyone else who has struggles with mental illness does, but it means that you've decided to stand up, to gather from that source of pain, to have strength. And that's what I draw from to become a mental health advocate. I want to be a part of the solution.
Thank you very much, Grace, for sharing that personal story of extraordinary courage and resilience. Thank you for sharing. I have 2 questions for you following up on that experience you shared. One, why do you feel that it's important to have an open dialogue on mental health, both during COVID, but also, after
Mhm.
COVID as well. And what are some of the sources of support that you found most critical in your work?
Mhm. Yeah, I have three main reasons why I love open dialogue about around mental health. One is that it reduces stigma, because if we talk about it, then it stops becoming an alien concept, and because everyone has suffered from mental health at some point in their life. And so opening up and talking about it definitely helps to reduce the stigma. The second one is that it brings to accountability the organizations or the people in power who need to do something, who need to enact change. So having an open dialogue means that people know what is missing and how these organizations or these parties can come in and change it for the better. And thirdly, I think it's way past time to keep quiet about this. I think the more we speak up, the more there's change, and the more that change helps other people to start. It triggers a revolution, basically. So that's one of the things. And then the support that I have seen that is most crucial and that we still need a lot of is for low resource settings. I think clinical support is still very necessary. We in terms of medication as well as clinicians themselves, we still have a dearth of clinicians specializing in in adult and youth mental health care. So I think we still need that, and then we still need a lot of high level policy decision making. And so I think support from governments and support from big organizations to advance mental health as an agenda definitely goes a long way in securing the sort of support that people living with mental illness need, or mental health challenges, not always mental illness. And then social support, obviously, through organizations like the Friendship Bench, right, from in Zimbabwe, but different other social ventures that are supposed to bring forward lived experiences and supposed to bring forward mental health for better and for the future. I think that's also a very important thing, way of support. And I guess all of these means of support help to reduce stigma and bring forward a better life for all of us. Yeah.
Thank you, Grace. And I couldn't agree with you more. And as you said, obviously we need societal transformation, breaking the stigma, breaking the taboo about mental health. But at the
Mhm.
same time, we cannot only put the responsibility on society. We also need policymakers to act, to pass laws, to allocate funding, to build the
Mhm.
infrastructure that you mentioned. So thank you so much for those very important points.
Yeah.
With Grace, I'm now moving on to Ku. Who is joining us from Singapore, and is a mental health professional and trained social worker. Ku, welcome to our webinar, and thank you for joining us so late in Singapore. So I heard that in your campus, your friends call you the mental health guy. Why do they call you that? And tell us a little bit about your journey.
Wow, thanks Jaya for the introduction. Yeah, I think it's interesting. I think my friends do call me the mental health guy because I think for the past 10 years, they do notice that I've been doing everything with mental health, right, in mind. And about 10 years ago, I think I was in a very dark place. And I'm very grateful, I think, for my family and friends who reach out to support me through this really tough times. And my uncle was actually one such person. And so I still remember very vividly when I asked him, how can I repay his gratitude, right? And he simply actually said that pay it forward. Yeah, and these three words I think have guided and also grounded me through the years. And so I think over when I was in campus, as a student, I founded a campus advocacy group to raise mental health literacy. And after getting my relevant training in psychology, social work, and solution-focused brain therapy, I am currently working as a youth mental health professional here at CHAT, the community health assessment team in Singapore. Yeah.
Thank you, Ku, for sharing your story with our viewers today. So I wanted to ask from you, Singapore is also one of the countries that the COVID pandemic hit first. So what do you see as common mental health challenges among young people in your country, particularly during the COVID-19 period? But also we know that whenever there is a disaster, whenever there is a humanitarian issue, young people also innovate in different ways to find solutions to those challenges. So I would like to hear from you both. What has been the mental health challenges for young people, and what innovations have young people brought in order to address them?
Wow, brilliant. I think thanks Jaya for that question, right? I think in the Chinese, I think there's this saying like called Wei Qi, right? Crisis and opportunity both come together. And first I must say I think this also gives me an opportunity to see the resilience of our young people. I feel that when I'm actually working with young people over in Singapore, I find them to be incredibly resilient, and I think worldwide as well, right? And that we each of us are all doing the best that we can in this period in facing it. And in Singapore, the circuit breaker measures actually started in the 7th of April 2020. And if you fast forward to now, it's been quite some time, right? Just contextualize it in Singapore, 80% of Singaporeans live in a high-rise public housing in close proximity to one another. So having to stay indoors for prolonged periods of time, especially in close proximity, I think Jaya, we can probably empathize and see how it might make existing challenges even more pronounced. And I think the top three presenting concerns that we hear, I think over in Singapore involve, I think one, a lack of privacy, as well as I think because the safe space, right, is now being a bit more cooked up, and being affected by the tensions that are at home, and the third thing I think is really experiencing some adjustments in adjusting to disruptions in routines, for example, like working from home, as well as I think learning, right, home-based learning. So I feel that we can definitely be a bit much more, as well as more empathetic towards youth, I think, in their adjustment distress, as well as the feelings of anxiety that some of the youth may face. But then let's also not forget that I think our youth, like you and me, I think we have the resilience to face this. And I hear a lot, I think, from you, I think, about, I think, possibly some of the things that we have been doing in Singapore. And I think that one of, because of this crisis, this pandemic that has been happening, it has kind of advance and also accelerate the embracing of telehealth measures over in Singapore. And face-to-face communication has been the primary medium of many mental health age services in Singapore. But given the current national lockdown measures to contain the COVID-19 outbreak, many of these services have actually switched from face-to-face to virtual platforms. And while our face-to-face services over here at Chat has actually been temporarily suspended, our web chat services continue to operate. And so young people in Singapore can actually communicate anonymously via text from their laptops, and this helps young people in distress who feel uncomfortable speaking over the phone because for fear that their family members might be listening in, they can actually now communicate to us in a text-based online platform. Although I must say this service was set up to serve Singaporeans, because I understand this is a global webinar. Yeah. In addition, the Singapore government has actually launched a 24-hour national care hotline to provide emotional support to people during the COVID-19 pandemic. And this hotline is actually manned by over 400 helping professionals, all stepping forward to volunteer. So let me sum up, I think, by saying that I see there's a lot of value in face-to-face engagement. There's still a lot of value in that. There's nothing quite like human connection, right, in a physical setting, Jaya. But in the lack of which, I think COVID-19 has reminded us of the potential that telehealth has in improving access to public mental health care and support. And I think that this will continue, I think, to change how we provide mental health care and support going forward.
Thank you very much. I think it's such an important point, and I think not just during the pandemic, but also after and in the recovery and rebuilding phase of countries, the type of investment and the kind of investment that goes into providing mental health services to young people is what you highlighted. So thank you very much for that important point. So from Singapore, I'm going to Belize, and I'm going to talk to Amy. Amy, thank you so much for joining us today. And similar to Ko and Grace, we would love if you could share with us short in a few sentences how you became a mental health advocate.
Hi, thanks for having me. I'd say I was around 13, 14. Going into high school, mental health was never a topic I focused on. And unfortunately, around this time, some youth in my community were committing suicide. And that was a wake-up call for me, seeing something so tragic happen, like taking their own lives and the pain they left behind with their friends and family. And for also some of my own friends and schoolmates. The following year after that, I joined my school's peer helpers club, and I worked alongside my counselor to educate myself and to help educate others in how we could see warning signs and how we could reach out and help people.
Thank you very much, Amy. So what are some of the challenges or the biggest challenges that you feel that young people are facing in accessing support for mental health or in accessing mental health services?
Yeah.
And how are young people, you mentioned about your experience in high school, how does, because with Coup and Greece, we spoke a little bit about, mental health services from governments and from civil society actors, but how does peer-to-peer mental health support work in your community?
Okay, so first, I'd say a big challenge would be that a lot of youths feel like their feelings are invalid. They're coming home feeling stressed, feeling anxious, sad, and trying to speak to let's say their caregivers, and that being perceived as being lazy or not working enough, and putting aside because they have things they say more important, like paying the bills and how they'll keep food on the table. So, and another big challenge is the mistrust. A lot of youth I've spoken to say that they don't know who to turn to. They don't know who to trust. If I go speak to someone, will they judge me? Will they speak about me and they perceive me as weak? So they prefer to bottle it up, and it could progress, and that could then turn into something worse. So I would say those are two of the biggest challenges. And I've actually seen young people become more aware on how to listen and see warning signs in their friends, and assure them that how they are feeling isn't crazy, isn't bad. It's okay to feel this way. It's okay to not be okay all the time. We're not perfect. So that is also okay, that to speak up and not feel like a burden. And I've actually seen young people reach out to others instead of that person going to them, they going, I see you not doing okay. Do you want to talk about it? So that's what I've seen so far lately, especially during this pandemic, people reaching out and seeing and speaking to each other.
Thank you so much, Amy.
Thank you.
With that, I'm going to, from Belize, I'm going to the UK. And from the UK, we have Jay Thompson joining us. Jay, what inspired you to take up mental health nursing as your career?
Thank you, and thank you for the opportunity to speak to everybody today. I didn't actually have a big calling in life to become a mental health nurse. I always had an interest in helping other people and supporting other people. And that came from volunteering for scouting, and that kind of sparked an interest. But my passion for mental health has grown greatly over time. And with the death of my friend by suicide about 3 years ago, I had a real motivation following the recovery from that bereavement to start working more in suicide prevention and raising awareness of mental health through first aid and through suicide prevention skills.
Thank you, Jay. And when you work as a mental health nurse, but also you are very active in the Scouts, and I know that in a lot of youth organizations and groups you work with as well. And from your experience, how do young people access mental health support services, particularly in the UK? And it would be really helpful if you could tell us a little bit about how you can be aware, how one can be aware of one's mental health and recognize when your stress levels are going up. And you call it a stress bucket, right? So what does it look like? And I think it will be really good for you to give some tips for our viewers today.
Thank you. So firstly, when it comes to accessing help, the first thing we need to be able to do is to be aware of our own mental health, because regardless of how well we are, becoming aware of our mental health and understanding what health is like is going to be really key in recognizing when things aren't going so well. And so in the UK, a typical thing to be able to access help would be firstly maybe through a crisis line or some sort of support line. There are many across the world. The two big ones that come to my mind in the UK are the Samaritans, who are a 24-hour, 7-day-a-week service, but also Papyrus, who have specific services for young people around suicide prevention, specific phone lines for young people. Another way you may access support might be through schools, or it might be through your family doctor or general practitioner, GP as we would call them in the UK, and they would, if needed, refer on to specialist support. But a big focus currently in the UK around accessing mental health support is accessing it within school. So being able to access some sort of low-level intervention at a kind of earlier point in time from a school or from a counsellor at a school-based level, really. So secondly, looking at our own mental health and understanding our own stress levels is a really helpful thing to be able to do. One way of doing this, and it's quite a common, fairly well-known analogy really, is called the stress bucket. And what I want you to do is to, you might want to first get out a bit of paper and pen and just scratch this away on a bit of paper, just to kind of get the idea on paper so you can come back to it later. But the idea is that we all have this ability, this capacity to deal with and manage stress. Stress is some sort of pressure that comes into our life. We all have some sort of stress. And actually a little bit of stress is helpful because it helps us keep motivated, helps us focus, helps us get energy. You know, imagine if you're a football player on a World Cup final and you're about to step onto that pitch. You need a high level of stress and adrenaline going to be able to really go and play the best game you can. If you were completely relaxed, you wouldn't be at the level you need to be at. So a little bit of stress is helpful. So the idea, if you draw out this bucket, is that we all have this capacity to deal with stress in our lives. And generally, gradually, as we grow older, as we have new experiences and we go through manageable adversity, our buckets and our capacity grows and develops. So our capacity to deal with challenges that life throws at us, generally, we'd expect it to get bigger over time. And the idea is that stress, life events or changes come into the bucket, and we have taps, coping strategies or resources that allow that stress to be released through these taps. So if you think about this analogy of this flowing bucket, so you've got stress coming in and stress being relieved through coping strategies. And we want to try and find some sort of balance in life where we're managing what's coming in and we're managing what's going out. What happens is if it gets too full, perhaps we've got some really big life events, some really tricky things coming in, it gets fuller and fuller and fuller and can overflow. And when it really overflows, or when it's really close to the top, we can experience a lot of anxiety. Perhaps it might go towards low mood or depression, and we can feel overwhelmed. And it's important to recognize what are my symptoms or what are my experiences that I have when I get too full, when things overflow. How do I react? So for me personally, I know through lived experience that I withdraw and become quite quiet, and I just want to shut things away and avoid them. Other people might get quite angry or irritated or distressed, and they might be quite irritable with other people. And so working out what your signs are for when your bucket's getting too full can be really helpful. And thinking about the coping strategies, these can be absolutely anything. These can be things that are hobbies, interests, friends, family members, people that you can chat to. And what we want to be able to think about is, how do I make sure I keep doing the things that help me when I'm stressed? When we're thinking about the pandemic, we've got to recognize that whatever was in our bucket, and also whatever the taps are before the pandemic will have changed the stress bucket. So looking at this now and thinking, what am I having to deal with that's new or different? And how am I less able to access some of the things I do to cope normally? And because what we need to do right now is reconfigure our stress buckets to work out a plan for managing now. And to answer the question that this webinar is about, really, it's about thinking, when reflecting on what's going on in my bucket, or what's going on with a friend in their bucket, and talking with them about it, and recognizing when things are overflowing and I've tried to try and manage, I've tried to cope through the ways I've learned to cope and it's not working, that's a really good sign that it's time to get some help and time to go and get some support. So I hope you find that analogy helpful. Do draw it and have a go at it, and all the best. Thank you.
Thank you very much, Jay. That was certainly an extremely useful exercise. And while you were explaining it, I was also doing it in my head, trying to figure out what are really the stress factors and then the taps in my life. And as you said, a lot of the taps have now been skewed because of the COVID pandemic. And we have to find sometimes new ways to open up those taps or find new taps connected to our bucket. And thank you. I'm pretty sure that it has been very helpful to all our viewers who are joining us from around the world today. Um, Thank you to all four of you for sharing your very personal stories, but also tips and strategies, and also recommendations for Yuan and the practitioners who are with us today. And with that, I close the first segment and move on to the second segment. This is the segment where we are breaking stigma and accessing care. We're going to talk about accessing care. And I have two remarkable young people who are working on these areas to join me in my second segment. And first, I'm going to introduce you to Aminata from Senegal. Aminata is a senior journalism student and is currently working on a documentary project about mental health in Senegal, which I think we are also going to get a sneak peek of. First of all, welcome, Aminata. Thank you so much for joining us. Tell us a little bit about your documentary and what messages you want to tell the world through your documentary.
Sure. So I wanted Senegalese people to really understand why it's like needed to implement mental health into all different structures of our lives, whether that is school, family life, or work. I think there's an urgency for it to be acknowledged and taken just as seriously as our mental and physical health, because I feel like they're tied to one another. And as for a motivator, my motivator was actually my family's history with depression. Around a year ago, one of my aunts passed away after suffering from depression for more than a decade. And that was really the first time I realized that my family was not really good at addressing mental health. This is also really influenced by our culture. In Senegal, we've got this philosophy called sutura, which is basically kind of avoiding to put people in situations that would make them feel uncomfortable, trying to really be discreet. And while that seems noble on the surface, it also keeps us from having conversations that we deem to be difficult. Therefore, I just really wanted for us to have these conversations, because to this day, I've still got family members that won't acknowledge that my aunt passed away due to her depression, and that my brother suffers from schizophrenia and depression as well. So all in all, I'd say that this was a way for me to open up a genuine dialogue about mental health and start discussions around it to push our leaders to take action.
Thank you very much, Aminata. And I think you also bring a really good perspective to this conversation. If these open dialogues are difficult to have, then why don't we use art and different creative methods of communication to really break that stigma and open up the conversation? So we're very glad that you could join and you could do this documentary. Thank you for doing it. I'm sure it's going to benefit not just those who are in Senegal, but also those of us who are all around the world as well. And with your permission, we would like to see a little snippet of your documentary as well. Thank you.
Traditionnellement, il y a une stigmatisation qu'on a remarquée. Cette stigmatisation ne va pas en faveur de la prise en charge de ces patients. Parce que comme souvent on l'explique aux gens, un paludéen, s'il vient à l'hôpital, un jeune paludéen de 18 ans, on le prend en charge sans problème, il rentre chez lui. Mais un jeune paludéen malade mental, s'il vient à l'hôpital, on a tendance à dire non, on l'amène à l'hôpital psychiatrique. Alors que le palud, ça n'a rien à voir avec la maladie mentale. Tout le monde peut avoir le palud. Donc la stratégie voudrait de sensibiliser les populations, que les populations sachent que la maladie mentale, c'est une maladie. C'est pas, comme on entend, c'est pas une possession démoniaque, c'est pas une malédiction, mais c'est une maladie comme les autres. Et cette maladie peut être prise en charge.
Écoutez, du point de vue du traitement, il y a une évolution. Mais du point de vue de la perception, je suis désolé, en Afrique, la situation reste sur place. Pourquoi? Parce que les gens ne considèrent pas les maladies psychiques ou mentales comme des maladies comme les autres. Très vite, vous êtes victimisé, très vite, vous êtes plus ou moins marginalisé, très vite, vous êtes victime d'ostracisme et les gens même en profitent pour, dans une certaine mesure, vous isoler socialement. Vous tuez même socialement. Et souvent même, bonjour les colibés, bonjour les moqueries, bonjour les rires. Donc, ils ont du mal à faire ce dépassement-là, d'avoir une maladie psychique ou une maladie mentale et du coup de guérir. Les gens, ils pensent que, d'ailleurs, il y a une expression assez bien particulière de chez nous. Les gens, ils disent que non, un malade mental ne guérit jamais.
Thank you so much, Aminata, for that clip, and all the best with your documentary. We'll really look forward to watching the whole of it once it's available. And from that, I'm going to talk to Leon, and my conversation around with Leon will focus around accessing support for mental health, because to this day stigma continues to be a critical barrier, as the previous speakers mentioned. So I want to try and understand what can help break these barriers and improve access to care. We have Leon today because Leon works with this organization called Cities Rise as the youth and advocacy lead, and supports youth programs in several countries that help young people play a greater role in their own care. So, Leon, thank you so much for joining us. Welcome. I have 3 questions for you. And my first question is, tell us a little bit about your experience and how it has shaped your life and your work on mental health.
Thanks so much, and a pleasure to be here with everyone. So my mental health journey started when I was leaving middle school, entering high school, and I experienced a number of mental health challenges that put me into treatment and different forms of care. And during that time, I realized that, and after, I saw that young people are often not asked how they can be the drivers of their care and delivery. Even questions around, is this working for you? How would you evaluate the success of this intervention on you, for instance? And it was a big wake-up call for me that young people their voices need to be embedded in everything we do for mental health. And so since then have worked internationally on trying to ensure young people's voices are a part of the design, delivery, and evaluation of mental health programs. And then the other piece of it is that from a social justice perspective, I really saw that mental health was core to achieving other structural and social and economic gains that need to be had to have a healthy and prosperous society. And so I really became passionate about how mental health intersects with poverty alleviation, how it intersects with gender and queer issues, how it intersects with peace and conflict. And so for me, mental health really became a unifying agenda that could create gains in every sustainable development goal. And so that really kind of oriented my passion, and I get to work with young people across the world.
Thank you very much, Leon. And in your experience working internationally, as you mentioned, what are some of the biggest challenges that young people face in accessing mental health care or in accessing mental health services?
Yeah, thanks so much. So I have 4 main barriers. I think the first is just the lack of mental health infrastructure and systems in general, whether it's trained professionals or community workers in most countries of the world. The second is the lack of integration of mental health into systems young people are familiar with, such as schools, sports leagues, online platforms, social media, things that actually resonate with young people. We still hold a lot of mental health support in hospital systems or in formal healthcare infrastructure, and that doesn't necessarily work for young people. The third is just lack of culturally appropriate care and support for young people. And what this particularly means is that young people need very culturally attuned, resonant information and people to deliver that information. And so, for instance, in the US, we have a very culturally diverse society, but so do many places in India and other places of the world. And so mental health care needs to have that cultural orientation as it's approached, and it often doesn't. And then the fourth and last is just simply not knowing where to go when services are available. I recently helped support a survey that was conducted around the world where we had 1,000 responses from young people in different places. And a vast majority of them said right now during COVID-19, they actually don't know where to go to get help for mental health support. And so this was actually a big awareness call that even when services are available, maybe it's actually not getting to young people in the right ways. And so I've seen those as a number of barriers.
Thank you very much, Lian. And what can help break these barriers, and what can help bridge that those gaps that you mentioned, and make a positive difference in addressing stigma?
Thanks so much. So one of the interesting things that just came out of the survey we just ran is that over 50% of all the young people we talked to said they would prefer to get mental health support from a friend or family member before a trained professional. And so this was a huge insight that we really need to be upskilling peers, friends, family members in basic mental health support and self-care so that they can be the front line of access. And so for me, it was that we need to expand who's providing care so that access is much more readily available. Other things that are really important are embedding young people in all aspects of design and decision making. We know that when they're a part of the solution, they're more likely to probably get benefit and access. Third is focusing on more relational work rather than health outcomes. Young people require healthy relationships in their lives to grow up and thrive. And I think that one of the ways in which we can increase access is by improving relationships that we have with young people themselves and focusing on that. And then I think we need to have creative mechanisms to have hard conversations about mental health. Young people actually resonate with art and theater and play and creative means of expression versus having a tough conversation with an adult. And so one of the things that I think is really needed to break down a lot of the barriers and stigma is to be able to use the creativity and ingenuity of young people to have these really tough conversations, for instance, around trauma or really unhealthy family environments, things that are really uncomfortable that actually need to be talked about when we're looking at mental health and well-being. And so I just think that young people need to be tapped into and their voice to really drive, better access for mental health. And just want to thank everybody for being here today.
Thank you, Lian. And I saw a lot of similarities or other connections of what you said to what our previous 4 youth speakers and Aminata spoke about, and particularly Amy was talking a lot about respecting young people's agency and realizing that young people are agents of change who can bring change to their own lives and not be treated as beneficiaries or adults in training who need support. So putting young people at the front and center of designing and delivery of mental health programs is what I really took out from your intervention as one of the key initiatives we can take to break those different barriers that you mentioned earlier. Thank you, Lian. And with that, I'm going to now Nepal. I feel like I'm going on a world tour, going into different countries, different people's living rooms, which is also really nice than having a meeting here at the UN headquarters. So I'm going to talk to Dr. Gunjan from Nepal right now. Dr. Gunjan is a medical doctor who is specialized in mental health support for children and adolescents. Welcome, Dr. Gunjan. And I have a sort of a set of questions for you, and I would love you to answer all of that in one go. First, what are some of the signs and symptoms of mental health that will need immediate care? So what are some of the signs and symptoms of mental health illnesses that need immediate care? How should one seek help, and when should one seek help? Thank you so much.
Thank you so much, Jay, for the questions. And then now moving forward to answering the questions. First, I'd like to just give a brief background. So currently we are in the situation of a pandemic, and there's this lockdown enforced in a lot of places around the world. So because of this, what has happened is For a lot of young people, there's this loss of the usual routine that they were used to. And then there's this loss of predictability, and there's a lot of uncertainty. So not being able to do the things and the things that they enjoyed on a regular basis, that puts them in a lot of stress. And with that, we can also say that in the given scenario, it is okay and it is normal to feel stressed, because this is a normal reaction to an abnormal situation, because we have a pandemic going on. But then it is also important to understand, like I think Jay had already mentioned earlier, that stress can also be sometimes good, because it motivates us in different ways, and this stress can also motivate us to sort of take precautions to stay safe and to be healthy. But sometimes stress can also make things difficult for us. So when that happens, there can be certain symptoms that we might see. And then we can talk about the symptoms in main three categories so that it becomes easier to understand. One would be the emotional symptoms. The emotional symptoms can be symptoms of sadness, it can be irritability, it can be feeling angry, it can be feeling anxious or fearful. So it does not necessarily just have to be about fear, because now we talk about the pandemic and you might say people might be feeling fearful, but then it doesn't necessarily have to be just that. It could be also sadness. And like, I think Jay also mentioned, like some people tend to shut down. So they might also feel numbness, it might be a lack of emotions altogether is what they might go through. So it could be these emotion symptoms. Then there could be the physical symptoms. The physical symptoms can come in the form of aches and pains. That would be your body giving you a message that something is wrong, like I'm not feeling well in terms of my emotions, but then the symptoms come physically. So it could be aches and pains like headaches and backaches or stomach pain. It could also be, feeling very restless and lethargic and lack of energy and all of that. So it could be these kind of physical symptoms. It can also have physical symptoms related to anxiety, such as palpitations and shortness of breath. So besides this, there can also be some behavioral symptoms. So in terms of behavior, we ourselves might notice that there might be some changes in the behaviors that we are experiencing. It could be that we might have become more argumentative than before. It might be that there might have been some aggressive gestures, some aggressive tendencies. These might have been seen. Sometimes there can be the inability to stay still in one place. So you have to move about a lot. It can also be that there might have been an increase in substance use, increase in the amount you would smoke on a regular basis, or if you are drinking alcohol, it might be increased, or you might have started taking substances to calm yourself down because somebody else might have advised you. So these could be some changes in behavior, and some changes in behavior could also come as maladaptive forms of coping that you might have taken up to sort of help you with the stress. Besides these, there can also be changes in your sleep and appetite patterns. So it could be either that you're not able to get enough sleep, or it could also be that you're sleeping more than usual because of the stress. And sometimes you might not feel like eating at all, but then sometimes you might be eating a lot to sort of help you deal with the stress. So there can be all these three kinds of symptoms. One is the emotional symptoms we talked about. Others are physical symptoms, and then the behavioral symptoms, along with some sleep and appetite disturbances. So these symptoms might be present in any kind of stressful situation. Okay, but then when do we know that we need to seek help if we have these symptoms? So if these symptoms are there, but then if these are more persistent, if it doesn't go away, it lasts for a long time, or it occurs in most of the days, and then it affects your daily functioning. Because of these symptoms, if you're not able to enjoy your daily activities, if you're not able to enjoy playing or talking to your friends and family, if you're not able to enjoy the movies that you would like earlier, so if you're not able to take care of yourself properly because of these symptoms, so if it affects you in that way, then and if it's not getting better with all the self-care measures that you are taking, which you might have been trying, that we've also talked about, if those also are not helping you get better, then definitely you should think that this maybe is the time that now I need to seek help. And it is very important to understand that it is absolutely okay to seek help about these things as well. And coming to the next question, which was about how can we seek help? So we did mention earlier that there can be some difficulties in reaching out, where to go, who to talk to. So what I would suggest is for all the young people, they could have a trusted adult that they could reach out to. The trusted adult could be a teacher, a family member, a guardian. It could be a peer group leader. It could be a family doctor or a school counselor. So it could be any one of the trusted peer group leaders that can be present in your surrounding, who may be present either physically or may be present over the phone. So you could contact them and then talk to them about the difficulties that you're facing. And then these people could help you contact either a counselor or a professional who deal with young people with such difficulties. And then you could talk about these difficulties with the people who are professionally working with these issues that young people might have. And then they will help you sort of manage these things in ways that will work for you. And for this, there can also be, there are helpline numbers, which such as child helplines, which the government might have started, or it might have been started by some trusted NGOs in your area. So it could be these numbers also, which you could get hold of. You could either call them directly, or you could talk to a trusted adult, and then they can help you contact even the helplines in terms of need. And besides these, there might be some other issues, like if there are ever thoughts of, like self-harm or even thoughts about suicide or thoughts about aggressive tendencies which may possibly cause harm to you or to somebody else in your vicinity, then it is very important that you contact somebody and then seek help, talk to the trusted adult, help them to ask them to help you access help in any way possible.
Thank you very
I
much,
think,
Dr. Gunjan. We really appreciate your insights, and I think for all of those who are watching us, it was really helpful, particularly the way Dr. Gunjan explained the signs and symptoms, but also the way he explained how and when to seek help and care. I hope was helpful to all of you who are watching us today, and with some very concrete examples and tips. With that, I'm going to now Geneva. As the last stop in my global journey, talking to young mental health experts, advocates, and now to our final mental health expert, Dr. Fahmy. We are very grateful to have Dr. Fahmy, who works with WHO's Department of Mental Health and Substance Abuse. Welcome, Dr. Fahmy. We know that you're a very busy person, but we really appreciate you making the time to be with us and talk to all the young people who are watching us today. Dr. Fahmy, can you tell us what practical resources are available for young people, particularly to take care of their mental health during COVID-19? And maybe you can also touch upon WHO's work on this particular area to support young people and adolescents as well. Thank you.
Sure. Jaya, thank you. I was asked today to share number of resources, but this is what you did in the webinar. I think Grace, Emi, Ku, and Jay, and Aminata, and Leon are all resources that young people have among many other leaders. I felt today humbled and honored to be their co-panelist. I usually go and do speeches in such webinars, but today I felt I'm a beneficiary and I learned a lot from all the co-panelists. So thanks to you and thanks to them and the organizers. I have few slides to share with you some of the published resources. One of the things that WHO have been working on is that since this is a global crisis, we can use social media on dissemination of messages on stress coping to different target groups and to different age groups. So in my slide here, I put one of our pages at WHO, Stay Healthy at Home campaign, where there is a mental health component. And I put two links here where our young people listening to us today can download some number of social media cards that they can use through their social media accounts to disseminate correct information and coping methods to different target groups. They can play a role in the response by dissemination of right, correct, and coping messages from their own social media accounts. Can we move to the next, please? Thank you. I'm putting here WHO stress management guide. This is recently released, only a few weeks ago. It is developed by WHO based on good science and based on testing in many countries, including in countries affected by large scale emergencies, such as in among displaced South Sudanese in Uganda who fled from the war, among people in Syria during the conflict, among displaced refugees in many countries. And these are difficult experiences, but also the experience of this pandemic and the stress it caused to different population is difficult. This book is about self-help. When you listen to this book and access its also accompanying audio materials, you are able to learn some strategies such as grounding, unhooking, acting on your values, acting here and now, some stress management skills that all of us can use in such unprecedented circumstances. It's relevant for young people, and they can also refer the link to others, including adults they know. Next, please. One of the things that WHO has been doing is working very closely with partners such as UNICEF and International Federation for Red Cross and Red Crescent Societies, and more than 50 other organizations through a committee called the Interagency Standing Committee to develop material that can benefit different target group. And in this very, very interesting cover, you can see responders from not only health workers, not only social workers, but you can see responders working in food industry, in grocery stores, working with people with disabilities, working on manufacturing, managers. You can see different responders. We believe that everyone can play a role in COVID-19 response. So if you are volunteering in any area of work in COVID response, if you know others who are volunteering, including your own, or doing their work as essential worker, including your own parents or family members, this guide is for them. This guide is for all responders to learn essential set of skills called basic psychosocial skills. How we can, in respect, dignity, and empathy, deal with everyone while you are responding to COVID-19. Again, I'm putting the link here where you can access this material. Next, please. Another interesting resource. This resource is reminding us that very young children, 6 to 11, your brother and sisters and others in your families can have a very good role to play in COVID response. Some of you may have seen this resource before. It was launched only last month on 8th of April, and targeting specifically this age group, which can be the age group of many of your brothers and sisters and family, where we advocate that you can read the story with them, telling them what role they can play. This story, when it was launched, only in 6 weeks. Only in 6 weeks, it reached now 121 languages, making it, according to Wikipedia, one of the list of top 20 most translated books in history. So it's a little bit one higher grade in the list than Harry Potter, which we are very, very proud of, although we all like Harry Potter very much. but we think what makes this reach in 6 weeks is that families, children, and volunteers and responders were very aware that it's not only the physical health needs which are important in COVID-19 response, but people everywhere, including the teachers who responded to the survey while we're developing this book, were aware that mental health and psychosocial needs are relevant for everyone, for all age groups, and all of us have a role to play. Thank you, Joya.
Thank you very much, Dr. Fahmy. And for those who are watching us, I'm not sure if you were able to access the links that were shown on the screen. So we will upload these links into my website, which is www.un.org/ Youth Envoy, and we will also share these resources once again on social media for you to have access as well. Thank you so much, Dr. Fahmi. I think those were some very practical resources about how young people can be resourceful in terms of the mental health response, but also can take care of our own mental health, can take care of our own families and our own siblings. And these are the kind of very practical tips that I think all our young people around the world will benefit from. So with that, we have come to the end of our session today. I hope all of you found this 1 hour useful. The insights, the energy, the peace, the strength, the hope, the resilience, and the solidarity, most of all, inspired me profoundly from our young practitioners, advocates, and experts. I hope that you will leave this conversation inspired too, but not only inspired, but also inspired to act and do something, at least to speak up and take action on raising awareness of mental health challenges, but also to reach out to a friend, reach out to a family member and check how they are doing, to hold your policymakers accountable, to ask the ministers responsible for youth, to ask your parliamentarians about how their governments are responding to mental health challenges, how much they're investing in particularly making mental health services accessible to adolescents and young people. So I hope that you will continue to stay engaged, and if you have questions, comments, and ideas about how our next webinars should be shaped, please write to me on youthonvoy@un.org. We look forward to seeing you in our next webinar, and until then, please stay both physically and emotionally well and safe. I wish you all the best. Until next time.